Good morning and welcome to the Caregiver Child Connection Program. My name is Minerva Villarreal, and I am the Foundation Program Coordinator with the WOMED Charitable Foundation. And I will be your facilitator for today's session. Today, we are joined by Elliot Montgomery Sklar and Lucy Barylak, and they will continue the series for the month of Pride with tips on aging in place and finding inclusive long-term care and LGBTQ plus perspective. Before we get started, I am going to give you a brief background on our speakers today. Lucy Barylak has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She has been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving and presents annually at the international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WOMED Charitable Foundation and clinics in Texas. Lucy would also like you to know that she was a caregiver for her mom for 10 years. Now, Dr. Elliot Montgomery Sklar is a public health professional focused on supporting the health of the public through academic work, research, and service. He has led the Healthy Aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is an associate professor of healthcare sciences at Nova Southern University in Florida, and he publishes and presents his work internationally, which is focused on the complexity of issues relating to aging and caregiving. And with that, take it away.
Thank you so much, Minerva. Good morning, everyone, and welcome. We want to know, please feel free to share with us either on the chat or by unmuting yourself during our discussion. And I do want to let you know that once our 1 hour session is finished, we're going to close the recording, and Elliot and I will still stay on for another half hour. If anyone has any questions that they would like to do, you can change your name so you really remain very anonymous. You know, most seniors want to avoid long-term care if possible, yet the LGBTQ seniors are more likely to require long-term care. Today, we'll outline ways to age in place safely and how to find inclusive long-term care when needed. So I'm going to be using the acronym LGBT because it's a little bit easier. The other one is extremely long. You know, while the US Census has never measured how many LGBTQ people live in America, reports estimate that there are currently around 3 million LGBTQ adults over 50. The number is expected to grow to around 7 million by 2030. Many people in the LGBT community that find themselves as caregivers to friends. Nearly 21% of the LGBT people provide care to elderly friends compared to only 6% of non-LGBT adults because in part, LGBT elders are 4 times less likely to have children. So it kind of makes sense. In the US, 85% of caregiving comes from adult children and partners. So when you remove adult children from the mix altogether, and there is a reduced presence of partners, by definition, you're creating a caregiving crisis. As a result, many elders in the LGBT community often face problems when trying to find nursing facilities that provide needed care while being culturally competent. As a result, LGBT elders are more likely to need long-term care, yet according to a recent AARP survey, over 60% of older LGBT adults are concerned about mistreatment in long-term care settings because of their sexuality. Since the pandemic, staffing shortages have been widespread across long-term care facilities, which have further concerns about accessing facilities that are welcoming to the LGBT seniors.
Hi, everyone, and welcome. Last year during our Pride of Caring series, we spoke about how mistreatment in long-term communities was a big concern prior to the pandemic, and actually it remains one today. In the US, the agency with the most experience in helping to move this issue forward in expanding inclusive long-term care for trainings for staff, for example, has been SAGE, and that stands for Services and Advocacy for GLBT Elders. Now, SAGE and the Human Rights Campaign, both advocates of rights for the LGBT community, have created the Long-Term Care Equality Index, which we've hyperlinked here in our slide for you, which means that when you get a copy of our handouts, you'll be able to click on the link and it will take you to the actual listing of the Long-Term Care Equality Index. And what this is to promote equitable and inclusive care for the LGBT seniors in residential long-term care and senior housing. Now, it's important that we understand that the Fair Housing Act prohibits the denial of housing based upon race, religion, or sex, but there is no federal law that explicitly protects people based upon their sexual orientation or gender identity. And thus, according to the Human Rights Campaign's Long-Term Care Equality Index, only 18% of senior housing communities had policies that prohibited discrimination on the basis of sexual orientation and gender identity. Now, their research sampled over 115 of the largest continuing care retirement communities and skilled nursing facilities. And in Texas, more specifically, because of course, that is where the WellMed Charitable Foundation is located, all of Texas, there are only 4 senior housing communities that are long-term care equality index partners, meaning that they have completed self-assessments of their own organizational culture and have committed to having LGBT inclusive policies and practices. Think of how big the state of Texas is to only have 4 institutions to choose from. And the reality is that when you're looking for a Medicaid eligible bed, for example, in a nursing home, very often you have to take what becomes available, which makes finding inclusive care somewhat of even a luxury, and it shouldn't be that way. Now, I was very hopeful last June when I shared that for the first time, President Biden declared a proclamation to declare June Pride Month, and he signed an executive order that included new steps to advance equality and also equity. And one of these was to strengthen supports for older LGBT adults, because older LGBT adults face significant rates of discrimination, isolation, and poverty. And as a result, the president had an executive order to HHS, Health and Human Services, to publish a Bill of Rights for LGBTQ older adults. And the new guidance on non-discrimination protections for older adults in long-term care settings was to have been included in that. It also charged HHS with exploring new rulemaking to establish LGBTQ individuals are included in the definition of populations of greatest social need under the Older Americans Act. In addition, he promoted expanded federal data collection on sexual orientation and gender identity because, as Lucy said, the census has never actually collected that information. And it's important to strengthen the federal collection of sexual orientation and gender identity data, very much so that we know how to allocate resources. And this is a perfect example of what we're talking about today. But as you know, politics are always evolving, and we're in the midst of one such evolution. And now long-term care states, actually, policies related to them can vary by state. And this June, for the first time in its 4-decade history, America's largest LGBT civil rights organization, the Human Rights Campaign, has declared a national state of emergency for members of the LGBTQ community, and this was announced last week. Our rights of the community have devolved in many states. Alongside the emergency declaration, the HRC released a digital guidebook, including health and safety resources and a summary of state-by-state laws. Again, all of this is hyperlinked here for you so that you can refer to that after our program today, because it's really important to know your rights, especially for people who live in or are traveling to what are included in this report as LGBTQ plus hostile states. And those do include Florida and Texas. Now, that makes it very challenging for us today to provide tips on finding inclusive long-term care because it's such a hot topic politically, and thus our rights and freedoms are changing. So we do want to orient you to the links that we have here because they're continuously evolving. The HRC, the Human Rights Campaign, and SAGE are really the places to turn when looking for inclusive long-term care options. But as we were saying, there are simply not enough facilities in each state and in each community. And so this link to the HRC in the middle of the slide here includes a list of all of those long-term care facilities that I mentioned. But it's important that we recognize that this might not be all-encompassing. As we mentioned last week too, even though policies are becoming increasingly discriminatory toward our community, apparently popular opinion polls state that overall acceptance of LGBTQ people and advocacy for their rights among the general public have never been higher. So it's very possible that, for example, a long-term care facility that might exist here in Florida that is not on this list might actually be a great long-term care option for people. So it's important to ask people within your community. You might want to check with local LGBT community centers or health organizations or senior groups for referrals and for support. And there are always as well local gay newspapers or magazines, which you can find online. Many of them have advertisements from healthcare organizations and facilities, which can be a really, really great resource. In past years, we shared with participants who were concerned about mistreatment in long-term care that under federal law, the Ombudsman program verifies cases of mistreatment or abuse in all licensed care facilities and helps to mediate problems with resolution. And now, while this is still the case, specific state laws, for example, might be in opposition. So if you do have a complaint, we are recommending that you contact your local area agency on aging in the facility in which your county is located and to get in touch with your local ombudsman program. I live in South Florida in an area with a high number of older LGBT couples. We actually have long-term care facilities and LGBT caregiver support services, things that don't exist in most other parts of the country. And yet, as a state, Florida passed laws that actually allow healthcare providers to discriminate based upon gender and sexual identity. So this is a very good example that there are certainly long-term care options that are very inclusive, even in states where protective policies toward our community are devolving. Now, a recent study, as I said, showed that more people are accepting and supportive of LGBTQ persons than ever before. I think it's just we're not seeing it politically. And I do also feel like despite what a facility or an organization stance on the issue is, what is happening politically is giving people more freedom to express their prejudices, which makes people feel, uncomfortable. And I do understand because we've heard from a lot of people in the community who are feeling concerned. So I think it's an important issue for us to look at. And for example, that president's order that I mentioned last year to strengthen the collection of sexual orientation and gender identity. Well, as you could imagine, in states where there might be repercussions for sharing that kind of information, that poses some issues for collecting that kind of data. But we really need that data to know how to budget and how to plan and for whom. So I was curious if anyone in the audience, because we're talking about long-term care issues, does anyone in the audience know what the life expectancy is of a gay man in the United States?
Come on, folks, go ahead and unmute yourself and I'll be able to call you as soon as I see it, or you can type it out in the chat. We would really love for you to interact with us.
That's a really good question, Elliot. I don't have a clue.
I
I've
don't either.
I've never seen it. Oh, you haven't either.
No,
Okay,
because we don't collect that kind of data. So when we talk about long-term care issues, isn't it interesting that this is something you'd think that we would need to know? What is the life expectancy, just anyone in the audience, of a transgender woman? Anyone have a guess?
Elliot and we actually have some comments in the chat box.
Good guesses. 70, 76, 56, 74. Those are good guesses, but there is actually no national data based upon sexual identity. Any guesses about life expectancy for a transgender woman? For a transgender woman, 50. 82. That's specific. Well, I don't have an answer to that either. There is one study published last year that actually found that transgender women have a life expectancy of 35. Okay, 35, which is 25 years less on average than the general population. And the main reason based upon this study was discrimination and violence against transgender people. But that is just one study, and others actually refute that data considerably, indicating a much longer life expectancy. We don't have the data nationally, and this is why it matters, because not knowing life expectancies, well, then how do we know how many programs we'll need or how many numbers of beds in a nursing home, for example? Women's life expectancy was 79 in the US in 2021. And for men, it was about 73. So those 6 years make a very big difference when it comes to planning for long-term care and for allocating resources. And back to that question about the life expectancy of a gay man, when I was researching this, I found a study from 1994. Okay, so that's about 30 years ago, and ahead of life-saving medications for HIV and AIDS. The average life expectancy of a gay man in 1994 in the United States was 43 years of age. So that's some powerful stuff. I think we know that LGBT adults have more health problems, more chronic conditions, for example, but we really don't know a lot of data. And according to a 2022 National Health Statistics report, those chronic conditions that our community faces include arthritis, asthma, cancer, diabetes, heart disease, and hypertension. Sounds very consistent with what everyone else goes through. New research is also showing, though, higher rates of dementia and Alzheimer's. And that's something that we're going to explore during our program next week. Because in this case, it would certainly stand to reason that we might need more long-term care as we age. But we need data for those resources. And that Bill of Rights that I had mentioned earlier, that President Biden spoke of last year, that was supposed to help and support LGBTQ older adults and providers in understanding the rights of LGBTQ older adults in long-term care settings, was also supposed to issue new guidance on non-discrimination protections, as I mentioned, on the basis of sex, sexual orientation, gender identity, and sex characteristics. Well, I haven't seen any updates on that Bill of Rights since it was announced last June, and I spent a lot of time looking ahead of our program today because we really clearly need those federal protections now more than ever. Now, I know this is a sensitive issue for a lot of people, but I really want to invite some discussion, and I would love to know what your thoughts are about all of these things that we've been talking about.
Well, I can only say that it's really quite shocking to hear some of the things that you were talking about today. You know, we thought that we believed that things were progressing along and there's more acceptance and but yet seems to be some sort of a political agenda somewhere there that sort of disputes a lot of the positive things that we thought were going on. It's very sad.
Absolutely. And because healthcare has a history of being attached to religious institutions, if you think of large hospitals, I know in my community, for example, the closest hospital to me is called Holy Cross. The largest hospital that I used to go to on Miami Beach was called Mount Sinai. So there are religious affiliations to a lot of healthcare facilities, and that's rooted in our history. But that can make community members feel incredibly vulnerable and perhaps not safe or protected under these new kinds of laws that are being passed in specific states. I have heard from people who have loved ones in long-term care facilities worried that this opens the door for discrimination, and that certainly is a concern. And if anyone participating today has similar concerns, we would love to hear from you.
I'm an ally, and I've worked in the health space for nearly 15 years, particularly in senior living. And one of the biggest challenges that I see is staffing turnover. And you could have an establishment do sensitivity training if they were willing to, but there's just such a turnover within those industries. I sit on an LGBT Elder Initiative committee through our local area agency on aging, and that's one of our missions, is to connect with our local long-term care buildings to advocate for sensitivity training, better practices with their anti-discrimination policies, but then also to be a resource for our LGBT elders to help them navigate, because it's a tough space. And I wish it was better. But it takes us all as advocates and supporters to make the change, right? So it's a tough space to be in.
I want to thank you, Trudy, for your comment, for your allyship, for everything that you do to support people in your community of all backgrounds. And I do agree with you. I think that the staff turnover issue in long-term care right now is a huge, huge issue of concern. Especially because when you invest in employees with training and so on, and they wind up not staying with you, that's a problem in and of itself. So I hear you for sure.
I think, yeah, we had something.
Bill actually put something in the chat.
Bill said that California signed into law long-term care Bill of Rights for LGBTQ older adults in 2017. Multiple other states have since put similar rights into place, and that is very true. And those are things to consider when members of our community are planning for long-term care. I know that a lot of people, for example, moved to Palm Springs at one point, and with the thinking that would be where they would age and pass on. And so there are different communities that have advocated for different bills of rights, the example here from California being one of them. And so people are thinking, well, maybe that might be a good state option for me to consider long-term care in for that safety, as an example. And we have another comment that it seems that fear is being politicized. I agree. Unfortunately, this has been a setback for the community that already faces so many obstacles. I agree 100%. Thank you all for your comments.
Yeah. Well, going along with all those issues, there are many LGBT individuals experience health disparities throughout their lives. While health issues in anyone's younger years may lead to the need for long-term care later in life, limited research shows that health disparities can have a major impact on some LGBT individuals, and this should be taken into account in planning for future long-term care needs. So, here are categories of disparities and other current understanding of how they impact the LGBT community. So let's look at that. LGBT adults are less likely to have health insurance coverage, more likely to delay or not seek medical care due to negative provider experience that they had. They just don't want to go back again. Facing barriers to access as older adults due to isolation and lack of cultural competent providers. One study found that 13% of older LGBT adults were denied or provided inferior health care. It's hard for me to imagine that, I have to say. One study found that 22% of LGBT older adults do not reveal sexual orientation to physicians. In some states now, healthcare providers can decline to treat or provide a certain necessary treatment to individuals based on their sexual orientation or gender identity. Wow. You know, research also indicates that if you live alone, you're more likely to need paid care than if you're married or single and living with a partner. Important implications for LGBT individuals, obviously, data shows that people living alone are more likely to need paid long-term assistance. Planning is particularly important for such individuals. Among LGBT elders, many single and couples are estranged from their families of birth, normally the largest source of support when long-term care is needed. Many in the LGBT community are resilient. They're relying on family of choice for their support and not necessarily their birth families. A major question often faced by those needing long-term care is, do you have family members who will provide care? Whether you have a family of choice, family of origin, or both to assist you in the event you need long-term support and services, plan ahead with your family now and begin to talk with your loved ones to develop a plan of care. So, I do want to pose a question. Do those of you participating today have a plan? Is there anything you'd like to share with others? So I have to tell you, I have a plan and definitely shared it with my children. They know exactly what I would like, if at all possible. So I'm just wondering, I know many people think, you know what, I'll do it at another time. So I'd like to hear from others. Do you have a plan for long-term care?
Come on, folks, go ahead and unmute yourself and share with us your opinions or thoughts, or you can always use the chat box as well.
I personally do not. Yeah, I personally do not, but part of my role in community outreach is discussing advanced care planning. And I recently presented to a group of LGBT men as part of our organization, and we were discussing for our LGBT folks, when they don't identify a healthcare surrogate and someone is picked by proxy, by law, that list may be challenging for folks. So for example, if someone doesn't identify their partner as their healthcare decision maker, oftentimes they're excluded from that process. So we're big advocates down here, and I'm in Florida. Challenging for sure, but it was a well-received presentation. And I think that's a good first step for anyone 18 and up, is to get that ACP in place, identify your healthcare surrogate, so that you're identifying who you want to make those decisions if you're unable. But definitely having worked in healthcare, the sticker shock of the price of long-term care is, I couldn't believe it when I started working. So it's definitely a topic to discuss and make sure people have plans in place. So
100%. It's so important, and the work that you're doing, I have to commend you on that. We need healthcare workers to work on issues like that and sensitize people. I thought that there were a few comments on the chats.
I also echo what you just shared, Lucy, and thank you for being an ally in Florida. We need all the allies we can get. Jane said, I'm an ally in Texas and encourage all of my older adults to complete and share with others their advanced care planning. And I certainly echo that. We used to do a whole program just called the folder on all of the documents that you need to have ready and available. But our political environment is shifting so quickly that it's almost impossible for us to stay on top of. And to that point, Andre said, I'm joining from Ontario, Canada. And although things are not perfect here, your data adds to my already great appreciation of our universal and inclusive healthcare system. And another sentiment that I echo, I am Canadian. I was born in Canada. I've worked and been a patient in both healthcare systems in Canada and here in the United States, and feel very privileged for the experience that I've had in Canada in both of those capacities, as a patient and also as someone serving the healthcare within the province in which I live. So thank you for those comments. Certainly there are different issues facing elders in Canada and in the US. And politics, unfortunately, mixes into that. But, you know, I think a lot of the issues that we're speaking of today, long-term care as an example, the fact that there is no universal federal protection, these are things that are very important that we advocate for. They're not things that necessarily come to mind, not things that I hear being discussed a lot in our community as a whole, and things that are so important. In doing a lot of research with Lucy and preparing for our program today, the things that I did were increase my retirement contribution because I'm going to need whatever resources I have to be able to afford long-term care. And I decided that I'm going to be more generous in sending birthday gifts to my niece and nephew, just in case I need them. So now, I think it's also very important, back to a comment that Bill had made about some of the protections available in California, that we think about aging and how age-friendly our communities are. And this isn't just about LGBT inclusive programs and support, but it's in terms of how supportive a community is as a whole towards seniors. And that's very important. And this links with so many different things because aging is complex. And not only does it require your own resources, money and others, and your own health, but it also requires the resources of the community in which you live. And for example, you might have a perfect home for aging in place, might be all on one level, but it might be in a rural area in which things are not easily accessible or close by. Or you might have a community that has limited resources to support seniors, including geriatricians, medical specialists, and other health facilities, and as well as many other supports like adult day centers, transportation, and support for caregivers. So one of the reasons actually in the history of the caregiver teleconnection is that it began about 15 years ago by phone, before we had Zoom and all of this, in Texas, because of how large the state is and how much of its population is rural. And for caregivers, particularly, community is so important in supporting healthy and independent aging. And technology has been very helpful, like it is today, in connecting all of us from wherever we are. So age-friendly communities help to encourage accommodations for senior populations through a whole variety of different initiatives, from simple things like infrastructure, making sure that there are ramps, that there are senior community needs that are being addressed, the geriatric programs in hospitals, that there is senior public transportation that's available, for example. Depending on where some of you live, that may also include keeping walkways and sidewalks well lit and clear of snow or ice, having bylaws that ensure that buildings have automatic door openers or elevators, stair railings or ramps, that they're friendly for disabled populations. So senior involvement in community activities and recreation is so important. That's why a lot of people move to 55 plus communities, because they have more things to offer. And I think also we've learned through COVID, through that experience, the importance of aging-friendly communities. For example, did your community have dedicated shopping hours at stores? Did they open earlier for seniors, for example, or have COVID shopping hours at off hours? That was something that was very important during the pandemic. Same thing with helping to get seniors vaccinated first and caregivers along with them. Not all communities had all of that worked out. So there are actually 450 towns, cities, and counties that are enrolled in the AARP's network of friendly aging states and communities. And that hyperlink is also included here for you on this slide. What was really interesting, again, in all our preparation for today, was one particular study from the University of Washington School of Social Work. And this was a survey of more than 2,500 LGBT adults aged 50 to 95. And what the study showed was that affordable senior housing, transportation, legal services, support groups, and social events were the most commonly cited services needed among the respondents. So it's important that that kind of echoes what we've been saying. We also need to remember that aging in place isn't only about what our home is like physically or home modifications. Staying at home has other mental and financial benefits. And by mental, I mean mental health benefits, because you're more connected to the community that you've been in. And older adults appreciate that familiarity, the memories, the home that they have. They tend to feel less lonely, less isolated, and less depressed. And staying at home can certainly be a cost-effective option for people, more so than moving into a facility. Now, Lucy and I have done programs that focus specifically on aging in place. And I would certainly welcome some of you to view those recorded programs if you want more detailed information. But I was curious, for those participating today, do you have any specific questions or comments or anything you would like to share from your own community experience?
All right, you can go ahead and unmute yourself or write your questions in the chat box.
I think this is a really important one. We need to think about this.
I just want to give an example. For those of you, I do live in Montreal in Quebec, Canada. And where I live in the area, there's a high percentage of seniors living here. And it might sound like a very simple thing, but there's a call-in for isolated seniors where volunteers actually call every day just to make sure that that person is okay. And it's such, it doesn't take long. Sometimes it's just, oh, I'm fine, thank you for calling. Other times it's, I'm not doing so well. Well, maybe you need to see the doctor. But that's what we're talking about, is those kind of services that allow seniors, especially isolated seniors, to remain in the community.
We have a couple of programs down here. I'm in Tampa Bay, specifically in Florida. So we have a huge senior population, a very welcoming LGBT community, both in Tampa and in St. Pete. So part of our organization, we focus on outreach to LGBT elders 55 plus. And part of that programming is social activities in person, coffee groups. I host an LGBTQ veterans group here in the community. So we're always seeking ways of social engagement, and we have two really big providers in our city, Metro All-Inclusive Care, as well as our EPIC program. So I feel like, we're very blessed for our LGBTQ population, some of the resources that we have that others may not. But we do, through that EPIC program, we have a friendly caller program where, similar to what you said, Lucy, it's volunteers connecting with our seniors. And that social isolation has just been so crippling through COVID and just some of the challenges within the community as a whole. But then you throw COVID into that. Our biggest challenge here, I think, is housing. Our housing market is really, really challenging right now. There's a lot of homelessness. Price points on housing is unattainable for many people. So I see that as being one of our biggest challenges here. I think we're doing well in the other sectors, but I agree that social connectivity and engaging is a huge part of being a friendly community.
Thank you for that. It's nice to hear that so much is being done.
Yes, and Trudy, I completely agree. I think that lack of affordable housing is a senior crisis for every community of seniors. So, in the interest of time, why don't we talk about aging in place?
Sure. Pardon me. Some people decide they want to age in place. I'm one of those people. For now, that's what I really think about. That's where I would like to be. And some people convert a room on the first floor into a bedroom, but that can require some additional costs and planning. So if you're lucky enough to have the financial means and are planning staying where you are, there are professionals known as certified aging in place specialists who can help you with planning, and you can access them through the AARP. You can also work with occupational therapists and social workers through managed care plans who are trained to provide the same experience. So it's important to ask you could ask your insurance and your healthcare providers about finding these individuals that can help you. Planning is so important so you can explore options for fixing problems and budgeting for any major changes, but not everyone has the means to do so. But there are small changes that you can make, like ensuring that floors are free of tripping hazards like loose floorboards or carpets around, especially if they're not wall to wall. Similarly, installing brighter LED light bulbs can be helpful to prevent falls and promote better vision, which changes as we age. These light bulbs are also more cost-effective and need to be changed less often. And some allow you to switch between warm and cool lighting, which makes a big difference for people with cataracts, for example. Habitat for Humanity launched a program to help people age in place, and their program offers free and low-cost home repairs and modifications to make older adults' homes safer and improve quality of life. You can also contact your loved one with the community service, such as house cleaning and grocery delivery. So we have that link by Habitat for Humanity locator tool to find a chapter near you. So I think it's really a good thing to start, and if this is something that could be extremely useful to you.
And that link will be provided with our resources today. Sorry, I jumped ahead a slide. I wanted to make sure that we have it. I wanted as well to make sure that we took a little bit of time to focus upon technology, because it can also actually very much help aging in place. But technology can be very intimidating, especially for older adults who may not be very familiar. Now, I know that I might be preaching here to the choir because we're all here on Zoom together. But in fact, the greatest disparities in using video telehealth exist among seniors, and even more so among seniors from diverse cultures. So one of the key recommendations that came out of the pandemic was the recognition of a better need to train seniors on how to use technology for the purpose of health, accessing health records, participating in support groups, reducing isolation and loneliness, for example, through connecting with others. So local senior centers and organizations often do have people who can help with technology setup and training. And I have learned actually that one of the key outcomes of the pandemic is that we have more senior serving organizations with dedicated programs and volunteers to help seniors learn how to use telehealth and technology to be more independent. Now, many of these programs are free or low cost for people who qualify. So I really recommend reaching out to your local AAA. You can call 211 in your community to find out what's available. These technology programs are often new. Many of them have come from recent funding that has come from this policy recommendation. If you're in the South Florida region, just as an example, in my own community, there's an organization called SOFIA, the South Florida Institute on Aging, and they have a program called SOFIA Tech, which is one of these kinds of programs led by senior volunteers. And there are also paid services that you can look for that will come to your home and set these things up. So we've included as well resources here for that. I want to talk about some of the top tech items that I think are really the most helpful for assisting people to age in place independently. Now, I know many of us have smart screens and speakers. Some of us have some concerns about these speakers being listening devices. But in my humble opinion, I think that for the majority of us, there ought to be less concern about who's listening in and more focus on these devices' ability to respond. For example, if we ask them to dispatch help. Now, studies are suggesting that older adults benefit greatly from smart speakers like Amazon's Echo. There are others like Alexa, Google's Nest, Apple's HomePod, and they're easy to set up with medication reminders. Some of them have fall detection, emergency alerts, and some also have integrated physical activity and stretching programs. So this is also true for smart screens like our smartphones and smart video devices, like the Amazon Echo Show and the Google Nest Hub. You can go to your local Best Buy, which is really what I recommend, to just browse through these things and have someone demo and show you how they work. But they've been very helpful in connecting loved ones with caregivers, telehealth appointments, and also emergency services. And their voice activation feature allows your loved one or someone that you might be working with to engage in social interaction by asking questions and listening for responses. Additionally, people with low vision can use a smartphone, for example, and hold their camera up and ask, "What am I holding?" Now, there are many, many advantages based upon different disabilities. You might want to consider working with an occupational therapist because there are things called assistive technologies as well. But a lot of these basic things are integrated into our smartphones already. Now, keep in mind, obviously, if you're using a phone, yes, you need to have Wi-Fi service or cell service. The same holds true in your home. You might need to have Wi-Fi in order to have some of these communication devices work because they are communication devices after all. Now, there are also activity and motion-based sensors, which are very helpful. We've heard from people who use sensors to detect activity like getting out of bed at night or if someone's trying to leave the house. Sensors can also be placed on doors, windows, kitchen and bathroom cabinets, on the stove, refrigerator, and so on. And they're very simple, actually. Many of these operate just with a battery. You don't need to connect them to anything. And you can install them actually with double-sided tape. You can find many of these things at Walmart, Home Depot, Lowe's, Amazon. They're very, very easy to install on your own. One key thing here is if you are looking to place them on a door to prevent someone from leaving who might have Alzheimer's and be wandering, you want to place that sensor high up so that it's out of their line of sight. The last but not least are smart light bulbs, plugs, and outlets. I love these because you can control things from your phone, from your tablet, computer, or from just speaking. You can say things like turn on the heater or turn off the lights. So if you're someone who has mobility issues, that can be very, very helpful. Now, you can also have these things set up so that they will turn off automatically and you don't need to worry about fire hazards, for example, like leaving a space heater on. These devices are simply very helpful, I think, especially, as I said, for people with mobility impairments and also for caregivers, because it makes it one less thing that you might need to have to do for someone. Personally speaking, I have had knee surgery, and after knee surgery, I kept a lamp and a fan in my bedroom on smart outlets, rather, so that I could turn them on and off verbally. It made my life much more comfortable and made me feel like I was less of a burden to the person looking after me. So we're going to share a whole bunch of resources here with you. And we do have the link here to that Habitat for Humanity Aging in Place program. Such an amazing, amazing resource, especially because we were talking again about the high cost of housing, which is a main issue for a lot of people and limiting some people. Lucy and I have talked in our previous program that I was referencing about aging in place, that a lot of people feel stuck in place right now because they can't afford to move elsewhere. So that is a reality a lot of people are facing from all communities. But we do have here the link to the Human Rights Campaign, the Long-Term Care Equality Index, and most importantly, that new digital guidebook that includes health and safety resources based upon state-by-state laws. I want to thank you again and remind you that after Minerva is done sharing some other information about upcoming sessions, Lucy and I will be staying on after the hour in an unrecorded 30-minute segment, just here to be open to your discussion and questions and comments. And thank you. I'm going to stop that because I realized I was previewing that website.
It's all right. And I want to say thank you to everyone that participated and made this presentation very interactive and very helpful for those that will be listening to it later on. A few words. We're halfway through the month and we have more sessions coming up. For Thursday, June 15th, we have the Oh, My Aging Parents Anxiety and Unhealthy Thinking Patterns with Dr. Natalie Oliver. And then we have the Conversation Project on Tuesday, June 20th. And for the series on next Wednesday, we have Alzheimer's, dementia, and the LGBTQ plus community. I will be posting a link on the chat, so in case you want to register ahead of time. And I would like to say thank you to Elliot and Lucy. This was a great presentation. Would you like to leave a few comments before I stop the recording and we can continue on with the rest of the presentation?
Sure.
Sure.
I just thought I saw a few little chat messages. Maybe
Yeah.
you can review them, Elliot.
Yes. Bill said to Donna that it's not just about having an LGBT person on a committee. That person needs to be well informed and have a good pulse on their community's needs. James shared, thank you for an interesting and informative program. Trudy said, fantastic presentation. Thank you all so much. Hildreth said, thank you for all the resources and information. And Minerva shared the link here to register for our program next week, which is going to focus upon this increased prevalence of Alzheimer's and related dementia among LGBTQ seniors. This you might have heard of in the news. This is something that has been discussed a little bit more recently and given more attention. And it's a really, really hot topic. We're going to look at the actual research and together come to a decision as to whether or not we agree with those findings. I hope that you'll join us.
And with that, I'll go ahead and stop the recording. And I want to say thank you, everyone, for participating. Please stick around for the remaining 30-minute session that will not be recorded.